Today in series of Docplexus KOL interviews, we have with us Dr. D. Ramamurthy. He's an eye surgeon and cataract and refractive surgeon with more than 25 years of experience. He's one of the pioneers in India in laser vision correction with more than 20,000 LASIK procedures already done. He's a member of various societies, namely All India Ophthalmology Society, European Society of Cataract and Refractive Surgeons, American Society of Cataract and Refractive Surgery, Asia Pacific Academy of Ophthalmology. He has received various awards, one of them which include Asia Pacific Certified Educator Award. He is also the chairman of Scientific Committee for 6 years from 2008 to 2014 and the president of AIOS in 2016 and 17. Thank you so much, doctor, for this interview.
Thank you.
So let's begin with our first question. Sir, can you please provide your insights on laser vision correction?
I think laser vision correction has come to stay. Cataract surgery is the most commonly performed surgery in the human body. The second most commonly performed surgery in the human body is laser vision correction. By laser vision correction, we mean the treatment of the eyes using the laser to change the shape of the cornea to correct the power, whether it's minus power, plus power, or cylindrical power. With advances in laser vision correction happening, the accuracy, the predictability, and also the safety of the procedure has gone up quite significantly. And nowadays we are able to evaluate these eyes quite extensively, and subsequently once the eyes are selected to be suitable for the procedure, we take them up. Usually before the age of 18 years, we don't want to do this procedure because there could be a fluctuation in the power, and we want the power to be stable at least for a year's time. And there is no upper limit for this procedure. Usually it is done bilaterally in both eyes, and then the patient can almost return back to all their normal activities the day after the surgery, whether watching TV, working on computers, during household work, getting back to their exercise and routine. Everything is just a next day they can go back, and it's an outpatient procedure. We have several advances in the procedure also, like we have the smile procedure, where it's the entire procedure is done through a very small incision, a 2 millimeter incision, and very minimal disruption of the tissues, or we use a femtosecond laser to create a flap and treat under that. So I started doing laser vision correction way back in 1997. What we are doing at that time to now, there is a sea change, and today I can say that it's no longer a cosmetic procedure, but it's a lifestyle procedure where whether the person is involved in sports or a lot of computer work, or is essentially a person in the household, or for deeply involved in leisure activities, undergoing this procedure does help.
So moving on to the next question. According to you, where does phacoemulsification stand in 2018?
I think again phacoemulsification has been around for almost 60 long years, and today by phacoemulsification we mean using the ultrasound through a small 2.2 to 2.5 millimeter incision to remove the cataract as a whole and implant an intraocular lens. And this has made the procedure extremely safe. Usually there is no injection given, there is no patch, the patient again can get back to all their normal activities almost the day after the surgery. And with the availability of multifocal lenses, toric lenses, etc., we are able to restore the vision of the patient to what they had, both the quality and quantity, at the age of what they had at the age of around 20, which is the best vision that every individual has. So because of this, it's no longer cataract surgery by phacoemulsification. It's a vision restorative surgery, but it's a vision enhancing surgery. And today, even at the patients undergoing cataract surgery with phacoemulsification at the age of 80 or so can expect to get excellent vision for all distances, even without the aid of glasses. Now, of course, we have further advances like using of the laser to correct cataract surgery, but these are complementary technologies and not competitive technologies. We usually pre-treat the cataract with laser, create the incisions, and subsequently remove the lens material and implant the intraocular lens using phaco techniques. Because of this, the kind of 99% of patients undergoing cataract surgery are able to get excellent visual correction.
So doctor, being one of the pioneers in phakic IOL implantation, can you share some challenging patient cases?
I think by phakic intraocular lens, what is meant is that uh, when there are extremes of power, say a minus 20 diopter or a plus 8 diopter, or the cornea is not quite rigid enough, then it's not possible to correct these extreme powers using laser vision correction on the cornea, because the cornea thins out too much and becomes unstable. So in these cases, we implant a lens in the eye. How it differs from cataract surgery is in that in cataract surgery we remove the natural lens and implant a lens in front of the implant a clear lens to replace the natural lens. Here, purely for correcting extremes of refractive error, we place a lens in front of the natural lens, which is quite clear, and it's again done in younger individuals. To mention a case which was handled from the human interest angle, there was a patient from Bombay who had a power of about minus 28 with minus 4 diopters of refractive error. Obviously, she was intolerant to contact lenses also, but was forced to wear it, and she had developed allergic reactions to contact lenses. So, wearing such thick lenses, going to work cosmetically, and even in leisure activities, she was finding it a extreme difficulty. So, she had visited us because she was basically from the south, and then we realized that she would be a good candidate for phakic intraocular lenses. She already had heard about the procedure, but she was told it's not possible to correct such extreme power even with phakic intraocular lens alone. So essentially, we placed a phakic intraocular lens of a power about minus 23 with minus 3 diopters, which because fortunately she had adequate depth in the anterior chamber to accommodate this lens, and that debulked most of the refractive error that she had. And finally, we fine-tune the outcome by using laser vision correction on the surface of the cornea. So this is what we call bioptics, where we combine the two procedures, that is using a phakic intraocular lens in front of the natural lens, and subsequently doing a laser vision correction on the corneal surface to enhance the quality of vision. So these are two different modalities combined together to achieve fairly accurate refractive outcomes, even an extreme refractive power like minus 28 with a minus 4 diopters. This was done in both the eyes, and today the lady is able to function most often without the aid for external glasses.
So my next question is, what is your message for the budding ophthalmologists?
I think ophthalmology is a great specialty to be in, and it's a rapidly evolving specialty, leave alone what I learned during my post graduation 30 years back. Uh, what I learned or what I was doing 5 years or 7 years back has no relevance today, because whether it's retinal surgery or cataract surgery or refractive surgery, it's something which is rapidly changing. But this is both an opportunity and a challenge, in the sense that it makes life very interesting and you are able to upgrade yourself and offer more and more to your patients. But at the same time, the challenge is that your equipments need to be constantly upgraded. You have to bring in new instrumentation, and that's economically a bit of a challenge. I think going forward, but one good thing is there's a hospital component or in an ophthalmic practice is very minimal. So in investing in infrastructure may not be so much needed as in other specialties, but you do well to invest on equipments, and most importantly, though technology is important, is the technique which is even more important. So don't jump into private practice. Yeah, I spend adequate time training yourself, equipping yourself immediately after your post graduation, because later on the opportunities may be quite limited. So once you feel very confident with what you are able to do, choose a subspecialty and concentrate on that. And I think the number of ophthalmologists that's required is extremely high. And please remember, it's not just the metropolitan cities that need you. It's more the smaller cities, smaller towns, where some excellent facilities are available, where you are most needed, most wanted, and you would find that within a matter of 6 months to 1 year, you are able to establish yourself. So number one, equip yourself adequately, buy the right kind of equipment, go where you're needed, and you will be an extremely successful ophthalmologist.
So doctor, lastly, how do you think Docplexus can help spread medical information regarding advanced management techniques for ophthalmology?
I think these are days of information technology, and most patients coming to us, even in a tier 3 or a tier 2 cities, are reasonably well equipped. They are quite knowledgeable, and I think Docplexus and other avenues like that are extremely important to give a balanced viewpoint to the patients. At the same time, we as doctors and you as media should also not hype up procedures. We must understand the limitations of what we can do also. A 80-year-old can never aspire to get exactly the same vision what he or she had at the age of 20 years, in spite of all the advances that we need to talk about. So we have to present a balanced viewpoint to our patients, but at the same time tell them that many many diseases which are considered to be untreatable just about a decade back are eminently treatable today. But having said that, the availability of modalities of treatment, say for conditions like diabetic retinopathy, glaucoma, age-related macular degeneration, etc., places a onus on us as physicians, you as media, to spread the message across. Because in these diseases, we're able to only retain the vision at whatever levels the patients present to us with. So it's important that these patients are encouraged to approach an ophthalmologist at the right time, so that effective treatment can be given to them and the vision can be retained.
Thank you so much, Doctor, for the interview. It was a pleasure having you here.
Thank you so much for having me over. Thank you.
Thank you.